Your badge is a contractor laminate with a barcode that never scans the same way twice. The emergency operations center hums behind taped doors. Radios chatter in clipped call signs. Someone hands you gloves, a sprayer, and a route marked hot, warm, cold. You're deniable labor in a clean-looking war. This is your life, level by level, inside a biosecurity response team assassin. Level 1: the sanitation runner. Your first assignment is just bleach, until it isn't. You push a gray cart that squeaks on sealed flooring. Disinfectant sloshes in a 5-gallon jug. The hallway is lined with plastic sheeting and blue tape arrows pointing to warm zone. A safety officer watches your hands like they're weapons. You wipe door handles, elevator buttons, crash bars. You twist red biohazard bags closed, tag them, and escort them to a staging area where a forklift idles. Every door has a rule. Approved names go through alone. Everyone else gets escorted, logged, and stared at until they stop asking questions. You learn the rhythm of checkpoints. Show badge, show gloves, show you belong. You tell yourself you're just cleaning. You tell yourself you're just moving trash. You tell yourself you're invisible. Then the supervisor taps your clipboard. Compliance mapping, you're told. You note who ignores isolation signage, who films on their phone, who asks where the bodies are going. That night, a new line appears on your route sheet. Welfare check, order service, with an address and a time window. You're told to bring zip ties and a spare mask. You came to erase germs, and you realize you're being trained to erase friction. Level 2: quarantine enforcement shadow. Public health order, police muscle, your quiet hand. You ride in the back seat of a county cruiser with your vest zipped, no patches, no clear agency name. The officer calls it supporting a public health order, like it's a parking violation. Your role is to stand half a step behind, holding a clipboard, speaking softly so neighbors don't hear. Paperwork first, eye contact second, doors last. You learn the language that makes people swallow fear. Section 361. 42 U.S.C. Section 264. CDC authority in theory, state powers in practice. The order says, isolation, and monitoring, and temporary, and you explain it like a customer service script while watching feet shift toward exits. You tell yourself compliance is safer. You tell yourself you're preventing spread. You tell yourself you're keeping it calm. Then you're told to prevent egress while transport arrives. You don't strike anyone, you just fill the doorway with your shoulders. The person inside panics, clawing at a mask, gulping air that won't come. You get praised for no scene, no video, and you feel how silence becomes your performance review, like a hand over a mouth that never leaves a bruise. Level 3 field containment specialist, contact tracing as targeting. You stop chasing the virus and start chasing people. Your day starts under fluorescent lights with a case list and a headset. Names, dates, exposure windows. You build a line list like shoe leather epidemiology, except there's no report to publish and no MMWR to cite. The room smells like cold coffee and printer toner. When a number doesn't answer, you mark it and move on. By afternoon, you're in the field. You sit in a rental sedan across from a townhouse, watching blinds twitch. You map movements from grocery receipts, badge swipes, and a friend's tagged photo that got deleted too late. You identify confidants, who they call when scared, who they call when angry, who they call when they think they have proof. You tell yourself it's containment. You tell yourself it's preventing misinformation. You tell yourself the system can't handle another spark. The intercept happens before they reach a lawyer, a reporter, or the airport. If they don't comply, the outcome gets written as an accident, an overdose during isolation, a fall in a decon shower, a respiratory collapse that occurs where cameras don't point. You stop counting cases and start counting loose ends, because people are the only vectors that talk. You've learned to clean, to escort, to block a door, to turn a spreadsheet into a trap. Next, you don't improvise in the field, you hide inside the incident action plan itself. Level 4 Operations Section Asset, ICS Tactics. You don't chase targets, you write the day they disappear. The incident action plan lands on the folding table at 0600, still warm from the printer. Page after page. ICS 202 objectives, and ICS 204 for each division, comms on the 205, medical on the 206. The tent smells like wet tvec and diesel from the generators. You stand beside operations while planners argue about resource typing and span of control, and your name is a line item nobody reads twice. By noon, you're walking the perimeter of a warm zone that exists because you stapled it into existence. A transport unit that isn't on any public roster. A decon lane that turns left instead of right. 2 escorts, with radios set to a talk group that never gets recorded. You watch check-in sheets and quietly circle the people who don't fit the operational picture. You tell yourself it's just coordination. You tell yourself it's just tactics. You tell yourself you're preventing chaos. Then you write an assignment that sounds like logistics. Relocate non-compliant PUI to alternate isolation site, and the team executes it like gravity. The paperwork becomes a tunnel, and people walk into it because it has an official header. At this level, you don't pull the trigger, you approve the map that makes the trigger unnecessary. Level 5 Select Agent Facility Enforcer, Biosecurity Clearance. You guard the lab that holds the truth and decide who leaves with it. Badge-in starts with a palm reader and a camera that tilts to find your eyes. 2 doors, an interlock, a hiss of negative pressure that you feel in your sinuses before you hear it. Inside, everything is stainless, sealed, labeled, autoclave logs, chain of custody forms, freezer racks with barcodes, red sharps bins that never overfill because someone counts them. Your uniform is plain. Your authority isn't. You audit access lists, confirm training records, and watch the BSL-3 routine like a liturgy PAPR check, suit inspection, buddy system, doffing steps taped to the wall. You sit in the security office with a live feed of corridors and a binder of incident scenarios that look like drills until they don't. You tell yourself it's all about containment. You tell yourself it's all about safety. You tell yourself the rules protect everyone equally. Then a researcher requests an export permit for sequence data and gets delayed until their flight window closes. A whistleblower's badge fails at the mantrap for revalidation. A sample goes missing and reappears with a corrected label and a new signature. The cleanest rooms in the building are where you learn that purity is just another kind of control. Level 6 The Deniable Director, Unified Commands Ghost. You don't give orders on paper. You steer the entire response with whispers, budgets, and silence. You don't wear PPE anymore. You wear a visitor badge and a calm expression, moving through unified command like you're lost on purpose. The conference room is beige carpet and bottled water, the kind of space designed to absorb urgency. A whiteboard lists public messaging, hospitals, supply chain, and nobody writes your name under anything. Your phone vibrates with numbers that don't have contacts. You nudge priorities with funding codes and tasking language. Surge staffing here, demobilize there, pause. A testing site that's asking the wrong questions. You make sure the right brief reaches the right inbox at 0430, and the wrong one dies in a shared drive with the wrong permissions. You tell yourself you're protecting continuity. You tell yourself you're protecting confidence. You tell yourself you're protecting the mission from politics. Then you watch a press conference and recognize your work in what isn't said. A doctor gets reassigned to administrative relief. A county health officer retires early. A problem becomes a narrative, and the narrative becomes policy. At the top, you're not the face of anything, just the hand that turns the room temperature until everyone agrees it was always that way. The laminate badge, the sealed doors, the soft voice at the threshold, none of it ever truly leaves you. The higher you climb, the quieter the mechanisms get. No more zip ties in your pocket. Just calendars, access lists, and words that make people move. You learn the final trick of biosecurity. The cleanest containment is the one that feels like routine.